likely is going to help her a lot, and most likely is not going to cause side effects, especially those of even Tarceva, which is an oral medication. We're going to hear from our sponsor for just a moment, and I'll be right back to take your questions and talk more about cases and what to do and some cancer news. So you can call us at 1-800-321-0710, 1-800-321-0710. We're live at the WOR studios. Bob and Ed are in the studio manning the phones. So we'll be right back.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman talking about cancer and health. New York Times article this week written by Adam Nagorny. California is proposing that physicians get drug testing, and he writes, at a time when random drug testing is part of a job for pilots, train operators, police, and firefighters, one high-level worker group has been exempt, and that is doctors. California is going to have a vote this November, a ballot proposal which showed approval in focus groups. It's being pushed by trial lawyers, and the whole purpose of this initiative is actually to raise the financial cap on malpractice insurances. Right now it's $250,000 in California, and they're going to raise it to 1.1 if this ballot initiative passes. So the lawyers are hot to get it out, and part of the initiative of the ballot, and in California you can put multiple factors on the ballot if it's related, is to have random drug screening for physicians. Now, it's a big brouhaha. There's certain people who want it, certain people who don't want it. Also, they're going to, as part of this initiative, if it passes, require doctors to consult state prescription databases before prescribing controlled substances to patients to guard against doctor shopping. Now, some patients who are on narcotics go from doctor to doctor to doctor, and there's no way to know what one doctor gives to another patient. So that's part of the initiative, and it's said to have a major effect in America if it passes. What do you think? Should doctors be screened? Or do you trust your doctor? Or should you screen them anyway? And in other news, Johnson & Johnson pulled this morselizer. There was a machine that morselized. It took pieces of a tumor inside a woman's uterus and kind of was like a blender, and took it and pulverized it. Well, a couple women have had cancers. Some women have had cancers that were pulverized, and then the cancer relapsed. And the theory here is that the morselizer, cutting through cancer, actually was related to spreading the cancer. And the rate of this is a few percent, so it's not insignificant, especially if you're one of the women. One of the women that this affected was in Connecticut, and she pushed for removal of the morselizer, saying she never knew about the fact that the cancer could be ground up and pulverized. And a bit about what we talked about before of that man with the cancer of the skin. How close were the margins? And often we see that with prostate cancer and a variety of cancers. When doctors cut through the margins, they can spread the cancer. Well, this morselizer is like a blender, and you can imagine if there's a cancer in the uterus, turn it into thousands of pieces. So that machine is being taken off the market by Johnson & Johnson. There'll be no more, and Johnson & Johnson was the primary maker of this morselizer. And there was another new study in the news that was published in Cancer Epidemiology, Biomarkers and Prevention, and it was described by the ASCO, which is the Cancer Society's post, in an article by Joe Cavello, that despite the fact that smoking increases the probability of cancer recurrence and reduces survival time, many cancer survivors continue to smoke. There's a new study that shows 1 in 10 cancer survivors continue to smoke 9 years after their diagnosis. 83% were daily smokers, smoking about 15 cigarettes a day. So these findings could identify survivors most at risk for continued smoking. Studies have shown that people that stop smoking have better survival rates than people who keep on smoking. Some people are amazed that 1 in 10 keep on smoking. Other people might say, well, 90% of smokers stop smoking when they get cancer. So it's a sign that for most people, you can stop smoking if you have the right motivation. And this study, which looked at almost 3,000 survivors of 10 cancer types that were studied and diagnosed between 2000 and 2003, and looked 10 years later, that's why the study's coming out. So it's an important study, and just a reminder that if you are a smoker, you may want to think about stopping smoking. If you've had cancer and you're still smoking, you can reduce your recurrence rate and improve your survival by stopping smoking. Stopping smoking is always a good thing. And another patient who came in, a man came in with 67 years old, came in with his brother and his clergy for treatment of lung cancer. He went to one of the big hospitals in Manhattan. He had a routine chest x-ray that showed cancer in the lung, adenocarcinoma. He's lost 30 pounds. He's gone from 160 down to 130. He is getting staged. You know what we like to do, which is stage up people. Now, at the other hospital, they said he had stage 4 cancer, 3 months to live, and sent him home. With us, he seems fully functional, in good shape, walking, talking, living on his own, caring for himself. So we're staging him up to see exactly where the cancer is, and then offer him options. I think sending people home with 3 months to live is not an option. It sounds like a death sentence. So people with cancer should know where the cancer is, what's the chance of success, what are the options available, and then the patient, who is like the President of the United States of their body, can speak to different doctors. That's why it's so important to have a second opinion. This patient came to us because he wanted a second opinion. His brother came with him. His clergy came with him. They all were dissatisfied by being told you have 3 months to live and 2 minutes to tell you and get out of here. No. We spend a lot of time, an hour, we get all the documents, we stage up the patient. He'll know exactly what he has and where he has. He'll know his options, and then he can choose what option's best for him. An option to try to get that weight back and get the cancer in remission. That's what we're going to try to do for him, like we try for every person. And we had another 79-year-old man who came in. He's blind. He came to the United States from Bari, Italy. Parla Italiano. He's an Italian stallion. He came with his daughter. His daughter has breast cancer and sadly had a mastectomy for breast cancer. So actually, they both came. They wanted to be fully evaluated. He had a lump in the breast, in the right breast, solid feeling lump at about the 6 o'clock position. It was small, but it was there, and you should know that about 1% of breast cancers do occur in men. Men are not immune from breast cancers. And in reality, most of a man and woman's body is very similar. There's an analogous part of the body, even of those sensitive structures that we think are so different. There's analogous parts in the man and the woman. So this man, who has been blind since the age of 16, he came to America from Bari, Italy. At just 1 year before that, he has this lump. We are sticking a little needle in. We're going to tell him exactly what it is. He got an ultrasound, mammogram. He'll know what it is. He'll have the paperwork. His daughter will have the paperwork, and then he'll have all the options. Hopefully it's not cancer, and about 80% of the lumps felt in the breast are not cancer. But nevertheless, if you have a lump, we urge you to come in. We had several people this week who've had lumps for a long time. We've had several women come in with lumps almost the size of golf balls. So please don't stay home. It's not going to get better by itself. Please don't stay home. You can come in. We can see what it is. We can put a little needle in the breast. We numb up the skin, put a little needle in the breast, suck out some cells, and you'll have an answer very quickly. It's a lot better than sitting at home wondering what that lump is. So if you have a lump somewhere in your body, whether it's in the breast or somewhere else, give us a call, 212-CHOICES, make an appointment. Let's see what it is. If it's cancer, let's treat it right, and let's hope that, of course, that it's not cancer. But in any event, we will try to do the right thing for you and give you all the options, give you the paperwork so you can understand exactly what you have. And this week, a gentleman with multiple basal cell cancers, he actually came in every day and had 4 basal cell cancers treated, and the cancers just melted away on treatment. It was fantastic. They were on his forehead and under his eye and his scalp. He was treated with focused radiation. The cancers went away. He was given skin care. He was given a follow-up appointment. We treat a lot of skin cancers like we spoke about a few minutes ago. Why? Because a lot of people don't want Mohs, which is a kind of a salami slicing technique to remove a lot of tissue. It started out actually as a way to minimize tissue removal, and now it seems so common. There's a variety of reasons for that. We don't advocate that. We think that each person is unique, and we talk about all the options for every person, whether it's surgery or focused beam radiation. The beautiful thing about our treatment is it doesn't have cutting involved. A lot of cancers are around the face and the head, the eyes, the ears, the nose, the mouth, and those tissues are really hard to correct surgically once the surgeon removes a lot of healthy, normal tissue. With us, we can treat most commonly, can't guarantee you, but most commonly treat the cancer without those deformities. So we're going to hear from our sponsor. We'll be right back. There's some new voices. My name is Dr. Lederman. We're from Radiosurgery New York, a cancer treatment center in the heart of Manhattan at 38th and Broadway. Our office is 1384 Broadway. We're not only super convenient, we're super. We answer your calls. We have doctors, not students, not residents. We're close to almost all buses, trains, subways, Grand Central, Penn Station, PATH trains, Port Authority. Just a short walk over to our office. We're in the heart of New York City. We have something called the Urgent Cancer Consultants, where we promise to see you within 1 business day. We'd rather take care of you than have you sit around and worry and wonder. So give us a call. Our office is 212-CHOICES, which is 212-246-4237. Also, if you want the booklet DVD, just call us during the work week for the booklet at 212-CHOICES, 212-246-4237. Here's a word from our sponsor.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES, for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super! Broadway and 38th in Manhattan. To hit your cancer,